penile implant surgery. Penile implant surgery is one of the modalities to treat erectile dysfunction. Most men, when the tablets and the injections don't work, they usually get a penile implant surgery. The American Urological Association guidelines in 2018 clearly mentioned that a penile implant surgery need not always be the last option. In fact, it could be the best option for a particular patient. So, at the first consultation with the patient, we always discuss all the options to treat the erectile dysfunction, and it's the patient's choice. He decides what he wants. And in penile implants, broadly there are two types. One is the semi-rigid, which is also called the malleable implants. Second is the inflatable implants. So as you see here, in semi-rigid implants there are again different varieties. So this is a simple silicone Indian implant which has no any core inside. This is just a simple silicone implant. This is the Tactra from the Boston Scientific. So this has some amount of memory, so that if you bend it, so it retains some amount of bending. So this has a memory when you compare it with this just a simple silicone implant. And this you see here, this is the Genesis implant, again from the Coloplast, and this is the tube from the Promedon, which is a German company. So in brief, so this simple silicone implant does not have a memory, whereas all the others, the other three which I showed you, they have a memory. In the sense, when I bend it, so it retains the memory, so that to conceal, this may be a better option than just a simple silicone implant. And when we do the semi-rigid penile implants, so two of these cylinders are inserted in the corpora cavernosa of the penis. That is when a person gets the erection. Coming to the inflatable implants. So in inflatable implants, again there are two subtypes. So as you see here, this is the 2-piece penile implant and this is the 3-piece penile implant. So in the 3-piece implant, there is a reservoir which is placed in the lower abdomen, and there is a pump which is placed in the scrotum, and these two cylinders are placed inside the penis. So this is the one component, cylinder is the second component, and the pump is the third component. Whereas in the 2-piece implant, so there is a pump and there are the cylinders. So how does these penile implants work? Most common questions my patients ask me is whether do these tubings, do they hang outside the body? Definitely not. All these are completely concealed inside. So when a patient needs an erection, so he presses this pump 3 to 4 times. That is when the saline that we fill in this reservoir goes into this cylinder and the person gets the erection. And once he completes the sexual act, he needs to press and hold this button for 2 to 3 seconds, and all the fluid from the cylinders will go back into the reservoir. So this is how, in brief, how these penile implants work. The next most common question which most of my patients ask me is how long do these implants last? And inflatable implant, the survival rate of this implant at 10 years is around 80 to 90%. Whereas when you compare this with the semi-rigid implant, most of these implants, since there is no any hydraulic mechanism that is involved, these semi-rigid implants usually last longer. But comfort-wise, definitely the inflatable implants are better because you get an erection only when you want it. Whereas in a semi-rigid implant, the penis is erect all the time, but one can easily conceal it by bending the central cord. So the length and the girth of the penis will not change after a semi-rigid implant is placed. And are there any complications? Yes, like any surgery, there can be complications. The infection rates are around 1 to 2%. So in the sense, if 100 patients undergo a penile implant surgery, 1 or 2 may end up with an infection. Of course, initially we give antibiotics to treat them. If it still doesn't subside, then we may have to remove these implants. This is again the same with any implants in the body. And yes, the patients usually have to wait for 4 to 6 weeks to resume the sexual intercourse. And the initial 3 to 4 days there may be some pain, after which most patients are comfortable. So this is in brief about the penile implant surgery. And yes, this is not something new. This has been there since 1973, 20 years before even the Viagra pills came. So yes, penile implants are an accepted modality for the treatment of erectile dysfunction.